Free CNA Practice Exam Updated, 2026. Question 1. Nursing assistants work in a lot of different places. One place that CNAs work is a skilled nursing facility. This type of facility is also called a ________________________ A hospital, B rehab center, C hospice, D nursing home. The correct answer is nursing home. A skilled nursing facility is also called a nursing home or long-term care facility. A hospital, while having skilled nursing positions, is not considered a skilled nursing facility, or SNF. Question 2. Many people, particularly older people, go to what kind of healthcare facility after they are discharged from a hospital after a stroke? A subacute care center, B a hospice, C a respite center, D a group home. The correct answer is a subacute care center. Many elderly people who have had a stroke go to a subacute care center, medical rehabilitation care center, after they are discharged from a hospital to regain strength. Question 3. A CNA, MA, and RN all provide care for 10 patients in a subacute facility. What is the term for this collaborative approach to patient care? Aide group care, B primary care, C team nursing, D rehab. The correct answer is team nursing. Team nursing involves multiple staff members providing different tasks in the care of the same group of patients. Question 4. A CNA is covering another CNA's lunch break on another floor. She answers the light for a patient who complains of chest pain. Who should the CNA report this finding to? A nurse, B provider, C director of nursing, D the other CNA when back from lunch break. The correct answer is nurse. The finding should be reported to the nurse immediately as the next step in the chain of command, as the patient may be having a heart attack. Question 5. You are asked to complete a bed change for a 300 pounds patient who is immobile and difficult to turn. You feel uncomfortable changing the bed yourself. What is your next course of action? A. Schedule a time with another nurse or CNA to have assistance during the bed change. B. Complete the bed change yourself even though you are uncomfortable. C. Wait until shift change to let the next shift take care of it. D. Tell the patient that they do not need a bed change. The correct answer is schedule a time with another nurse or CNA to have assistance during the bed change. If you are uncomfortable making a bed change, it is appropriate to ask for assistance, especially with an obese or immobile patient, to prevent injury. Question 6. Which duties would be performed by a CNA in team nursing? A. Assessment of the heart and lungs. B. Teaching physical therapy exercises. C. Taking vital signs and blood sugars readings. D. All of the above. The correct answer is taking vital signs and blood sugars readings. Taking vital signs and blood sugars readings would fall under a CNA's scope of practice. Assessments are for nurses, point teaching is for therapists. Question 7. The CNA can legally __________________________________________________________________________________________________________________ A. Supervise other CNAs. B. Teach other CNAs. C. Mentor other CNAs. D. None of the above. The correct answer is none of the above. While it is appropriate for a CNA to orient another CNA, a CNA cannot legally supervise, teach, or mentor other CNAs. This is the role of the nurse. Question 8. The director of nursing at your long-term care nursing home has assigned you to be in charge of the nursing home for the weekend. What should you do? A. Refuse to do the assignment. B. Do the best you can do. C. Ask about the details. D. Call the owner. The correct answer is refuse to do the assignment. Supervision is not within the scope of practice for a CNA. You can be legally charged with unlicensed activity if you accept a job that is not within your legal scope. Question 9. Which of the following actions is ethically wrong in the care of nursing home residents? A. The CNA remains right outside the bathroom door and instructs the patient to pull the call light when they have finished urinating. B. The CNA wipes the patient's finger with an alcohol swab prior to taking a blood glucose level. C. The CNA does not let a confused high-fall risk patient ambulate in the halls without assistance. D. The CNA chooses to complete an incontinence change every 4 hours on a patient who is incontinent every hour. The correct answer is the CNA chooses to complete an incontinence change every 4 hours on a patient who is incontinent every hour. Waiting to change the patient every 4 hours can cause skin breakdown if the patient is incontinent every hour. Changes should happen more frequently. Question 10. A patient requires a dressing change for the first time after surgery. Which of the following staff cannot legally change the patient's dressing immediately after surgery? A. CNA, B. LPNC, RND, MD. The correct answer is CNA. A CNA cannot change a patient's dressing immediately after surgery as this requires an assessment of the condition of the wound. Question 11. Which of the following is now the minimal requirement to be able to legally record and document data, such as vital signs and blood sugar readings, within a hospital setting? A. Experience, B. A certification, C. Licensure, D. College degree. The correct answer is certification. Holding a certification, such as a nursing assistant certification, is the minimal requirement to make a legal record of patient information. Question 12. Who developed the hierarchy of needs? A. Erickson, B. Piaget, C. Maslow, D. Nightingale. The correct answer is Maslow. Abraham Maslow developed the hierarchy of needs. Question 13. The levels of the hierarchy of needs are underscore 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 underscore. A. Of physical needs, safety/security, love/belonging, esteem, self-actualization. B. A need for freedom, need for resources, needs of self, needs of others. C. A subjective needs, objective needs, data analysis, needs for resolution. D. Integumentary system, respiratory system, nervous system, cardiac system. The correct answer is physical needs, safety/security, love/belonging, esteem, self-actualization. The levels of Maslow's hierarchy start with physical needs and move up to self-actualization. Question 14. The CNA is working on a busy med-surg floor. Vital signs are due, trays need to be cleared, and a patient is complaining of chest pain. Which is the highest priority? A. The patient is requesting a full bed bath right now. B. Taking vitals on all patients since they were not taken at 0800. C. The patients have finished their meals and are requesting the trays to be taken from the room. D. A patient is complaining of chest pain after surgery and is requesting pain medicine. The correct answer is a patient is complaining of chest pain after surgery and is requesting pain medicine. A patient complaining of chest pain is the highest priority and should be reported to the nurse immediately. Question 15. It is nearly time for your lunch break. A nurse is requesting assistance with an incontinence bed change. Which of the following is not a proper response? A. Gather supplies and assist the nurse with the bed change. B. Tell the nurse you cannot help as you are going on lunch. C. Delay your lunch if needed to assist the nurse as possible. D. Request the CNA covering your lunch to assist the nurse. The correct answer is tell the nurse you cannot help as you are going on lunch. It is not appropriate to refuse assistance to care for a patient within reason. The CNA should assist or find coverage. Question 16. You are the CNA caring for Mrs. Thomas. You see a notation on the nursing care plan that states, ambulate at least 10 yards QID. This patient will be assisted with ambulation at which of the following times? A. At 10 a.m. B. 10 a.m. and 2 p.m. C. At 10 a.m., 2 p.m. and 6 p.m. D. At 10 a.m., 2 p.m., 6 p.m. and 10 p.m. The correct answer is 10 a.m., 2 p.m., 6 p.m. and 10 p.m. QID is the abbreviation for 4 times per day. Common intervals are 10 a.m., 2 p.m., 6 p.m., and 10 p.m. Question 17. The RN asks you to bring the unit's collected lab specimens to the lab stat. You should underscore 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 underscore. A. Not do this errand because CNAs do not do stats. B. Run this errand as soon as you can see. You run this errand immediately and without delay. D. Before the end of your shift or after your lunch. The correct answer is run this errand immediately and without delay. STAT is the medical abbreviation for immediately and without delay. Question 18. Hospital policy states that patients on the medical floor should have vital signs taken every 4 hours. Which of the following is an appropriate abbreviation for this order? A. V signs QIDB versus Q4HRSC a vital signs QODD a vitals QDX4. The correct answer is versus Q4HRS. Q4HRS means every 4 hours. QID means 4 times a day, which isn't necessarily every 4 hours. QOD means every other day. Question 19. What does the medical abbreviation ADL stand for? A. Activities of daily living. B. Advantages of disability and life insurance. C. Assessment of depth and length. D. All day long. The correct answer is activities of daily living. ADL stands for activities of daily living, eating, bathing, dressing, etc. Question 20. You are caring for a patient with a BKA. What do you expect to see when entering the patient's room? A. A patient with an amputation below the knee. B. A patient with tubes coming out of both kidneys. C. A blood sugar of 600 once you take a finger stick glucose. D. A patient with swollen legs from heart failure. The correct answer is a patient with an amputation below the knee. BKA stands for below the knee amputation. Question 21. Which of the following lists the 5 senses? A. Sight, hearing, taste, smell, and common sense. B. A hearing, taste, smell, common sense and auditory. C. A sight, taste, smell, auditory and visual. D. Hearing, smell, taste, sight, and touch. The correct answer is hearing, smell, taste, sight, and touch. The 5 senses are hearing, smell, taste, sight, and touch. Question 22. What senses do nursing assistants use to observe patients and residents? A. Sight, hearing, and touch. B. Sight and hearing only. C. Is sight and common sense only. D. Taste and hearing only. The correct answer is sight, hearing, and touch. CNAs use sight, observing, hearing, listening, and touch, feeling for temp/moisture, to observe patients. Question 23. A CNA is caring for an immobile patient and notices a new open sore to the patient's sacrum. What should the CNA do? A. Report this finding to the nurse. B. Place barrier cream over the sore. C. Ask the patient how they got the sore. D. Do nothing. The correct answer is report this finding to the nurse. She should report the finding to the nurse immediately so an assessment can be made. Question 24. A CNA is working in the resident dining hall and notices a resident grabbing at her throat without making any noise. What should the CNA's response be? A. Perform the Heimlich maneuver. B. Start chest compressions. C. Slap the resident's back. D. Call for help and wait. The correct answer is perform the Heimlich maneuver. The universal sign for choking, silent, requires immediate intervention with the Heimlich maneuver. Question 25. A CNA is bathing a child on a pediatric hospital unit. She notices the child has bruising to his arms and legs. What should be the CNA's first response? B. A. Call Child Protective Services. B. Ask the child what happened. C. Confront the parents. D. Report the finding to the charge nurse per hospital protocol. The correct answer is report the finding to the charge nurse per hospital protocol. The first response is to alert the nursing staff/charge nurse to document findings and follow hospital protocol. Question 26. Which risk factor places patients and residents at the greatest risk for falls? A. Old age. B. A middle years. C. A pneumonia. D. COPD. The correct answer is old age. The elderly are at the greatest risk for falls due to weakness and other age-related conditions. Question 27. Which sensory impairment places residents and patients at risk for falls? A blindness, B confusion, C a weakness, D the aging. The correct answer is blindness. Blindness is a sensory impairment that directly increases fall risk. Confusion and weakness are risks but not sensory impairments. Question 28. You are caring for a resident in an Alzheimer's unit. The resident is repeatedly pushing on the locked door trying to exit. Which of the following would be your first response? A. Unlock the door and allow the resident to exit the building. B. Take hold of the resident's elbow and direct them toward the room. C. Attempt to verbally reorient or redirect the resident back to their room. D. Assist the resident to their room and apply restraints. The correct answer is attempt to verbally reorient or redirect the resident back to their room. Approaching calmly and verbally reorienting/redirecting is the best first response. Question 29. You are working in a dual occupancy room when the residents start arguing back and forth. What is the best response? A. Tell the residents they must stop arguing. B. Notify the nurse or resident care manager. C. Change the room for one resident. D. Pull the curtain between the two residents. The correct answer is notify the nurse or resident care manager. Notify the nurse or care manager to handle the conflict and prevent escalation. Question 30. Which of the following is most likely to de-escalate a disoriented patient who is starting to become verbally abusive? A. Address their concerns in a slow and calm manner. B. Shout at them to snap out of it. C. Close the door to their room. D. Physically assist the patient back into a supine position in bed. The correct answer is address their concerns in a slow and calm manner. Talking in a slow, calm manner is the most effective way to de-escalate agitation. Question 31. A CNA notices an uncapped syringe lying on the floor in the patient's room. What is the CNA's response? A. Safely pick up the syringe and place in the sharps container, then report it to the nurse. B. Ignore the syringe, the cleaning staff will find it and dispose of it. C. Safely pick up the syringe and place it in the trash can. D. Leave the syringe in place and report it to the nurse. The correct answer is safely pick up the syringe and place in the sharps container, then report it to the nurse. Immediate safe disposal in a sharps container prevents injury. Reporting it allows for investigation. Question 32. The fire alarms in your nursing home begin ringing. Nobody on your unit is in immediate danger. You must now underscore 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 underscore. A. Evacuate the patients laterally. B. Evacuate the patients vertically. C. Close the patient doors. D. Open the patient doors. The correct answer is close the patient doors. Following race, if rescue is done, nobody in danger, an alarm is sounding, the next step is contain, close doors. Question 33. A small contained fire breaks out in a trash can. No visitors or residents are in immediate danger. You have pulled the alarm. What should you do next? A. Extinguish the fire if you can do so safely and without harm. B. Run away from the fire. C. Cover the fire with a blanket. D. Open the windows and exit the floor. The correct answer is extinguish the fire if you can do so safely and without harm. Race, rescue, alarm, contain, extinguish. If safe and small, extinguish is the next step. Question 34. Which of the following locations would provide you with the most up-to-date information on how to respond to a disaster within your facility? A. Google search. B. Ask another CNA. C. The Facilities Policy and Procedures Manual. D. Human Resources Handbook. The correct answer is the Facilities Policy and Procedures Manual. The Facilities Specific Policy and Procedures Manual is the official source for disaster protocols. Question 35. In the event of a tornado spotting near the proximity of the building, what is the CNA's response to maintain patient safety? A. Move patients as far away from windows as possible. B. Assist ambulatory patients to exit the building. C. Do nothing, the building is secure. D. Take patients down to the basement using the elevator. The correct answer is move patients as far away from windows as possible. Moving patients away from windows prevents injury from flying debris and glass. Question 36. Which patients should be evacuated first in the event of a fire within the area? A. Mobile patients or patients on life support. B. Small children and ambulatory patients. C. Patients requiring transfer assistance or use of a stretcher. D. Patients in wheelchairs or who can ambulate with walkers. The correct answer is small children and ambulatory patients. Ambulatory patients and children are evacuated first as they move quickly, followed by wheelchair/walker users, then immobile patients. Question 37. You hear the code for an infant abduction. You notice a suspicious person walking with a large bag quickly through the halls. What is your response? A. Tell the person to give you their bag. B. Ignore the suspicious person. C. Block the exit to prevent the suspicious person from leaving. D. Safely attempt to detain the person until security arrives. The correct answer is safely attempt to detain the person until security arrives. Attempt to safely detain, example through conversation, until security arrives. Do not put yourself in harm's way. Question 38. A patient is confined to their bed and needs assistance at meals. What position should you place the bed in as you are feeding the patient? A. Supine. B. High Fowlers. C. Or reverse Trendelenburg. D. Lateral. The correct answer is high Fowlers. High Fowlers, sitting up, is the safest position for feeding to prevent aspiration. Question 39. When cleansing the genital area during perineal care, the nurse aide should underscore 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 underscore. A. Cleanse the penis with a circular motion starting from the base and moving toward the tip. B. Replace the foreskin after it has been pushed back to cleanse an uncircumcised penis. C. Cleanse the rectal area first and then clean the patient's genital area. D. Use the same area on the washcloth for each washing and rinsing stroke for a female resident. The correct answer is replace the foreskin after it has been pushed back to cleanse an uncircumcised penis. Retracting and then replacing the foreskin is crucial to prevent constriction and infection. Question 40. Which of the following tasks would more likely be performed by a nurse? A. Feeding an Alzheimer's patient who does not have trouble swallowing. B. Ambulating a low-fall-risk patient with a walker. C. Bathing a surgical patient prior to surgery. D. Trimming the toenails of a patient with diabetic neuropathy. The correct answer is trimming the toenails of a patient with diabetic neuropathy. Trimming nails on a diabetic patient requires assessment and care to prevent injury/infection, usually reserved for nurses or podiatrists. Question 41. Underscore 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 may result when patients or residents ignore the urge to defecate. A. Constipation. B. Diarrhea. C. Incontinence. D. Hemorrhoids. The correct answer is constipation. Habitually ignoring the urge to defecate leads to constipation and fecal impaction. Question 42. The chain of infection includes the underscore 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 underscore. A. Germ, agent, reservoir, exit portal, mode of transmission, entry port, and susceptible host. B. Active natural, active artificial, passive natural and passive artificial. C. Opportunism, weakness, immunity, and colonization. D. Intrinsic, extrinsic, internal and external transmission. The correct answer is germ, agent, reservoir, exit portal, mode of transmission, entry port, and susceptible host. The chain of infection models how germs spread from reservoir to host. Question 43. Asepsis is defined as underscore 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 underscore. A. The absence of all microorganisms. B. The absence of disease-causing germs. C. A urinary infection. D. A pathogenic infection. The correct answer is the absence of disease-causing germs. Asepsis is the absence of disease-causing germs, pathogens. Surgical asepsis is the absence of all microorganisms. Question 44. Which of the following patients is likely to be placed on contact precautions in a hospital setting? A. A patient with MRSA. B. A patient who is coughing. C. A patient who just had hip surgery. D. An elderly patient. The correct answer is a patient with MRSA. MRSA is a resistant bacteria requiring contact precautions to prevent spread. Question 45. What are standard precautions? A. Hand washing or hand sanitizing between patients, wearing gloves if handling bodily fluids. B. Wearing gloves at all times, only hand washing between patients. C. Wearing gloves and a mask while in the patient's room. D. Gloves and hand washing is not required between patient rooms. The correct answer is hand washing or hand sanitizing between patients, wearing gloves if handling bodily fluids. Standard precautions, used for everyone, include hand hygiene and using gloves when in contact with bodily fluids. Question 46. Which of the following hospital floors would you most likely expect to see reverse isolation precautions? A. Surgical. B. Oncology. C. Obstetrics. D. Alzheimer's. The correct answer is oncology. Reverse isolation protects immunocompromised patients, like oncology patients, from germs the staff/visitors might carry. Question 47. Which of the following is an example of a skeletal hazard of immobility? A. Contractures. B. Constipation. C. Calcium loss. D. Catabolism. The correct answer is calcium loss. Calcium loss from bones, leading to osteoporosis, is a skeletal hazard of immobility. Question 48. An emotional consequence of immobility is underscore 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 underscore. A. Depression. B. A dementia. C. A delirium. D. A diversion. The correct answer is depression. Depression, isolation, and poor self-esteem are emotional consequences of prolonged immobility. Question 49. Which of the following age groups are at the highest risk for injury-causing falls? A. Elderly. B. Middle-aged. C. Young adult. D. Children. The correct answer is elderly. The elderly are at highest risk for falls that result in injury due to frailty. Question 50. All of the following are preventive measures to avoid pressure ulcers in the elderly, except A. Repositioning every 2 hours. B. Applying skin barrier cream to high pressure areas. C. Changing incontinence pads as soon as they are soiled. D. Applying contracture boots in an immobile patient. The correct answer is applying contracture boots in an immobile patient. Contracture boots prevent muscle shortening, not pressure ulcers, and can sometimes cause them if not checked. Question 51. Where should the wheelchair be placed when transferring a stroke patient from their bed to the chair? A. On the patient's weak side. B. At the foot of the bed. C. At the head of the bed. D. On the patient's strong side. The correct answer is on the patient's strong side. Placing the chair on the strong side allows the patient to use their strength to pivot and sit. Question 52. Which of the following would not be considered a fall risk intervention? A. Fall mats. B. Bed alarm. C. A non-skid socks. D. Restraints. The correct answer is restraints. Restraints are a safety measure for behavioral/medical harm, not a standard fall intervention, and are used as a last resort. Question 53. 2 CNAs are caring for a total care elderly patient with dementia. Which of the following scenarios is incorrect? A. The CNAs stand on either side of the bed to help turn the patient. B. One CNA holds the patient while the other cleans the peri area. C. The CNAs discuss another patient's care while caring for this patient. D. The CNAs boost the patient up in bed using the draw sheet. The correct answer is the CNAs discuss another patient's care while caring for this patient. Discussing another patient is a HIPAA violation and unethical. Question 54. Your patient says they have chest pain and a pounding heart. They are sweating and have blue lips. These signs indicate A. A nervous and anxious, B. Having a panic attack, C. Having a heart attack, D. Calling out for emotional attention. The correct answer is having a heart attack. These are classic signs of a myocardial infarction, heart attack, and require immediate reporting. Question 55. Thomas, 77, has leg edema, fluid restriction, and daily weights. What disorder is he likely affected with? A. Diabetes, B. Dementia, C. Congestive heart failure, D. Contiguous heart disease. The correct answer is congestive heart failure. Edema, fluid restrictions, and daily weights are standard care for congestive heart failure, CHF. Question 56. You are caring for a diabetic patient who reports dizziness and is shaky and sweaty. What do you expect the nurse to ask you to do? A. Take the patient's blood sugar, B. Take the patient's vital signs, C. Call a rapid response or code, D. Answer the call light of a patient who is requesting a walk. The correct answer is take the patient's blood sugar. The symptoms suggest hypoglycemia, low blood sugar. Checking glucose is the immediate necessary action. Question 57. You are assisting an elderly female patient to the bathroom. What is important to emphasize to prevent urinary tract infections? A. Wipe from front to back, B. Stand up slowly to prevent dizziness, C. Make sure to press the call light when you are done, D. Put one hand on the walker and one hand on the seat to press yourself up. The correct answer is wipe from front to back. Wiping front to back prevents fecal bacteria from entering the urethra. Question 58. You notice a patient has a shuffling gait, jerky movements, and some difficulty speaking but is oriented. What do you suspect? A. Alzheimer's, B. Heart failure, C. Parkinson's disease, D. Stroke. The correct answer is Parkinson's disease. Shuffling gait, festination, and tremors are hallmark signs of Parkinson's disease. Question 59. A patient is complaining of shortness of breath and wears a nasal cannula at 2L/min. What disease do you suspect? A. Coronary artery disease, B. COPD, C. UTI, D. Constipation. The correct answer is COPD. Chronic obstructive pulmonary disease, COPD, causes shortness of breath and often requires supplemental oxygen. Question 60. Which is considered a normal or healthy type of grief? A. Anticipatory grief, B. Complicated grief, C. Unresolved grief, D. Inhibited grief. The correct answer is anticipatory grief. Anticipatory grief, grieving before a loss occurs, is considered a normal part of the process. Question 61. A family member informs you that their culture does not permit a dead person to be left alone. Hospital policy states bodies go to the morgue. What do you do? A. Gently explain the policy to the family and then implement it. B. Notify the nurse about this cultural concern. C. Call the deceased patient's primary care provider for advice. D. Move the deceased patient to an empty room and stay with the body yourself. The correct answer is notify the nurse about this cultural concern. Notify the nurse immediately so the team can attempt to accommodate the cultural request within policy. Question 62. A hospice patient's lips/hands are blue and there is no chest rise. What is the CNA's next action? A. Start chest compressions. B. Call 911. C. Shout at the patient to wake up. D. Notify the nurse. The correct answer is notify the nurse. Notify the nurse to confirm death. Hospice patients are DNR, do not resuscitate. Question 63. Which of the following hospice tasks should not be performed by a CNA? A. Taking vital signs as requested for the family. B. Providing repositioning and perinatal care for the patient. C. Providing emotional support for the family. D. Determining time of death for the family. The correct answer is determining time of death for the family. Determining/pronouncing death is the scope of the nurse or physician, not the CNA.